all for being here. Chris, are you able to hear me okay?
Yes, I can. Can you hear me?
Yes, great.
Great.
Well, I know everyone will be very understanding of the fact that this technology is a little bit new to us, and things are changing just about every hour with regard to some of this information that that we have seen on this topic. So thank you everyone for being with us and for bearing with us, I guess I should say. If there's any technical difficulties, we will definitely try to work that out and address it for next time. This information is going to be recorded. This call is recorded for playback later, and we'll also be sharing the deck. There's a few links that we have to share, so not to worry regarding any access to the information afterwards. We've got over 100 people registered to be with us tonight, which is just fantastic for our community to come together and have this time amid this crazy social distancing period. So if everyone could make sure that they are muted, unless you are one of our presenters, I think that will help us be sure to kind of have some housekeeping in place here. So we've got with us today two presenters that I think many of you probably know. We have Dr. Amy Paller and Dr. Leonard Milstone joining us. So we thank both of these guys so much for their time and for their continued work to help us in the ichthyosis community understand these new issues as they emerge, and to help us make sense of what it means for our ichthyosis in short. So I've got, let's see, a couple of other housekeeping items, I think. So in addition to being muted, if you could, you're able to join a chat box if you would like. If you have questions for the panel, you can email Chris right now, or you can go to the chat box. To go to the chat box, there should be a little icon at the bottom that says chat, and then the chat box should appear at the right. So you can either chat everyone with your question so that we don't replicate questions, or you can send your question just to Chris if you'd like to be anonymous. Chris, are there any other housekeeping announcements that I've forgotten? Oh, you're on mute, Chris.
Okay. It was just muted again. Can you hear me now?
Yes, I can.
I'm hearing feedback, so I think some people are unmuted by mistake. Make sure you have the microphone with the slash through it, just to make sure. I did hear some feedback.
Let's see, let me make sure if it's. Okay. Is the feedback better now for everyone?
I didn't hear it then. That sounds good.
Okay. Well, any other announcements, Chris?
No, we're all set.
Wonderful. Well, if you guys have any friends that this information might be pertinent to, you can let them know that we're sharing this on Facebook Live right now as well. So if you have access to our Facebook page, you'll be able to see the live stream, and you can share it that way as well for anybody who might want to join at the last minute. Other than that, we've got a number of things to go over. I know that there have been a lot of questions and a lot of just unknowns in this. So we will try our best to address the questions that we've already received, and we'll go over what we know for sure about the disease, and then all the things that we don't really know enough about yet. We've had a chance to kind of run through some of the questions that we've already received, and so we're prepared to address some of that, but we'd also like to save some time at the end for everybody to share ideas and questions and tips if there's anything in particular that you have found that works for you and your family or your type for some of these interesting measures that we're having to take. I think one of the best things about this community is the ideas and information that we are able to share directly with one another. So we'll try to save time for that at the end and keep things as focused and as pertinent to the whole group as possible. And if there's ever any specific questions that come up as we go along, feel free to go ahead and enter that in the chat box as it comes up, and we'll try to address it at the end. So without further ado, I'm going to turn it over to Dr. Milstone, who's going to kick us off. Dr. Milstone, are you there?
I am here. So can you all see me? Welcome. I see Denise.
I see you.
You do? Okay. Wonder what's the problem here.
I can see you, Len.
Okay, I should pop up every time the speaker should come up on the screen usually. So I see Chris now. I'm not sure what's going on.
I see you, Len. You're up on the screen.
Okay, is
you, it's okay.
slide deck on the screen also?
Yes. You can't see the slide deck?
I can see the slide deck.
Yes.
Okay. All right, well, welcome everybody. I noticed there are a number of people on this call who I haven't seen in maybe a couple of decades, and that's very nice. Dr. Paller and I are going to do the best we can to answer your questions about how this COVID-19 relates to ichthyosis. Just to begin, I will tell you that there's very little data about it, but we'll do the best we can. As you all know, this has been very disruptive to our lives in many different ways. Dr. Paller and I will do the best we can to address the medical and epidemiologic issues. We're not going to be able to help you very much making decisions about how you get to your favorite movie or whether you should go to work or some of those other more difficult suggestions. But we'll introduce this for about 10 or 15 minutes, and then we'll get it open for questions. So I want to emphasize that there are no validated data that give us real good information about how someone with ichthyosis should approach this. And so what I'm going to be talking about to begin with is just some of the general information that I've gleaned over the last several weeks, months, about this particular virus and what we might be doing about it. I think it's very important for us to start out by saying that getting our data from good sources makes a real lot of difference. There's a reason that the word truth, either in Latin or Greek, appears in the mottos for many universities, and that's because the truth is often hard to come by. There are various ways of looking at things, and people interpret their data in different kinds of ways. To actually figure out what is accurate is not always that easy. And so I think it's important when we talk to each other about something as unknown as this COVID-19 virus, we take into account the kinds of information that the speaker or the journalist or the other people who we're talking to have, what their background is, whether they're talking about data that is their impression or information that actually has been validated in some kind of way that would be acceptable to the scientific or the medical community. Denise, if you could put up my first slide. Yeah, so we all rely on people who we trust. And listening to a lot of people on the television, the radio, and going to a bunch of different websites over the last several months, these are the two people who, if I were to tell you who to listen to get good information about this particular virus and the epidemiology of it, and what we should be doing from a medical point of view and a social point of view in terms of preventing spread of this virus. These two people are the people I would go to. The first is Anthony Fauci, who many of you I'm sure have heard on the TV in the last several weeks. He's the director of the National Institute of Allergy and Infectious Disease. And Peter Hotez, who is the dean of the National School of Tropical Medicine at Baylor and also the president of the Sabin Vaccine Institute, where he worked on a vaccine for a related virus in this coronavirus group. If you can listen to what these people say or read their websites or their Twitter accounts, those are the people who, I'm not sure Dr. Fauci has a Twitter account, but I think Peter Hotez does. Those people are very thoughtful, and they know a lot about infectious disease, viral disease, and the epidemiology of epidemics like this, the one we're experiencing now. So let me just say, I'm a dermatologist. I've taken care of patients with ichthyosis for over 40 years. When I was a medical student, I spent a couple of years in a virus laboratory studying viruses that cause epidemics. And so viruses have been an interest of mine for a long time, but I am not an expert in this particular virus or even in viral diseases. So the information I give you will be general from what I've gleaned. After I've talked for a few more minutes, Dr. Paller will talk. Dr. Paller is probably the most experienced dermatologist, at least in this country, in terms of treating patients with ichthyosis. So I think she's going to be talking mostly about how you will be dealing with this with regard to your ichthyosis. So if we could have the next slide, Denise. Okay, so we're going to talk a little bit about the virus and the host, how they interact, because I think it's important to understand that so you can understand the next three topics that I'll be talking about. So this is a virus that grows in epithelial cells, mostly in the mucous membranes and the gastrointestinal tract. Viruses cannot grow by themselves. They have to grow inside a cell. And in order to get into a cell, they have to interact with the surface of the cell. And so many of you have probably seen a picture of this coronavirus. It has little spiky things on the outside of it. These are, if you think of those as little keys, the keys have to fit into a specific keyhole in order to get into a cell. If the virus can't do that, it can't get into the cell, it can't replicate, it can't make another copy of itself. It has to get into the cell to make a copy of itself. And so those receptors are very important. And those receptors are not found on every single tissue. They are found primarily in the mouth and the nose and the lungs and in the gastrointestinal tract. They are not found in the skin. And so that kind of information is important for us to know simply because it reassures us that we're not likely to get this virus through our skin. Basically, it can sit on our skin and live on our skin, or not live on our skin, it can sit on our skin without dying. But in order to do any damage, it has to be moved to a mucous membrane. So the next thing, so that's pretty much the important thing about the way the virus works. Once it gets into the cell, it can replicate. It causes enough inflammation in your lungs and in your upper airways that you start sneezing. When you start sneezing, you blow this virus out on little particles of liquid, and those particles settle on surfaces. You catch the virus by touching the particles on a surface, and then you, with your hand or some other way of getting that viral particle into your mouth or your nose or your eyes, that's how you get infected. So that's really the important thing to know about how this virus works. I'll say one other thing about this. We know some information about how long the virus lives and what it lives on. I don't know whether you're really interested in that. If you are, can ask questions. But I did want to say there's a slight difference between this virus and viruses such as the measles virus. The measles virus is known as an aerosol virus. When you sneeze, the virus stays in the air for a long, long time because it's on such a small liquid particle. And so you breathe it in, and that's how you get exposed to it. This virus is thought to be primarily a droplet virus, which means that it ends up in rather large drops of fluid. Those fluids settle on surfaces, and really the primary way in which the virus gets into your body is you pick up the virus off a surface and you put it on one of your mucous membranes. So now let's talk a little bit about prevention, and I think I have a slide about that. Prevention.
Dr. Milstone, two quick things. Just to clarify, so we know that we get the disease through mucous membranes. If we have cracks or fissures on our skin, does that count as a mucous membrane? And the second item is, I think some people are having trouble hearing you. If you could speak up just a little bit louder.
Oh, usually I yell. Let me see.
Shout it out.
Let's see what's going on here. All right, let's see if I can turn up my volume here. I'm already at the top, so I'll have to yell a little bit more. Okay, so a fissure on your hand or a crack in your skin or an abrasion in your skin is not a mucous membrane. And in fact, when you look at the database that says where the receptor for this virus is expressed, it's not expressed in the skin. And when they say the skin, they probably mean the epidermis as well as the layers below the epidermis, the dermis, and the fat. It's really not. It's not there. So I don't think you need to worry about it coming through cracks. Can you hear me now?
Yes, I think we're good. Thanks for the answer.
Okay, and the next slide about the prevention. This is something I want people to be focusing on. Obviously, for this particular disease, prevention is the most important thing because we don't have any good treatments for it. And this is true for many viral diseases. Social distancing is something that everybody has talked a lot about, and for each one of you, it will mean something different. But in general, the fewer people you see and the more you stay away from other people, the less risk you will have. Prevention means you're going to reduce the risk of getting the virus yourself or passing the virus on to somebody else. At this particular time, the medical community is very concerned about passing it on to somebody else as much as they are about what to do for people who actually become infected with it. So the most important, which you should all understand now because you understand that this is spread by droplets that you pick up, is frequent hand washing. And soaps and sanitizers, those sanitizers that contain ethanol or bleach, are very effective at killing this virus within a very short period of time. And when we talk about things like sanitizers and things that might kill the virus before it gets to our mucous membranes, there are two things that are important. One is how potent is the particular agent, the ethanol or the bleach or the soap, and how long do you have to use it in order for it to be effective. And for those three things, generally within 10 to 20 seconds of application, the virus is pretty much gone. So that's number one for prevention. Number two is don't touch your face, your eyes, or your nose. One of the other places that I get a lot of information is from the Johns Hopkins website, as well as from the CDC website. Those are two very valuable places where the people who established those websites have thought a lot about epidemics and the kinds of things that are necessary to prevent them from spreading. I guess the other little credential I have is that my son is on he's the hospital the associate hospital epidemiologist at Hopkins, and so he and I have been talking about this for the last 2 months. But their website is very valuable. If you have a runny nose, use tissues and discard the tissues in the trash immediately. If you sneeze, cover the sneeze with a tissue or with your elbow. And if you're sick and you want to prevent the spread to other people in your house, you should wear a mask. Masks actually do help preventing the spread because they pick up a lot of those droplets that would ordinarily settle on surfaces. They don't last for very long, and so you would have to change the mask on a fairly frequent basis. But if you're sneezing a lot and you don't want to infect other people in your house or your community, wearing a mask is worthwhile. It doesn't help very much to protect you. So they're not particularly good at protecting you, and that's because you're not breathing these viruses. You're putting the virus onto your mucous membranes either by touching your face or something, or rubbing your eyes. Okay.
Dr. Milstone, we had a question about ethanol. How would you suggest we use ethanol to sanitize?
Oh, well, so ethanol is the important ingredient in many things such as Purell. And ethanol is a very good sanitizer if it is at 60 or 70% ethanol and 30 or 40% water. It's very important actually that it be mixed with water in order for it to be effective. And back in the old days when I was working in this virus laboratory, and actually still now, the surfaces of the hoods that people work in are always sprayed with ethanol. That's still sort of the number one way of killing viruses on surfaces. Don't drink
What
it.
about
If the question was, do you put it on your skin or drink it? You should be putting it on your skin, not drinking it.
So we're getting a number of questions here, and I want to make sure that we get through everything. I'll add one more.
I'm going to be done in less than 5 minutes. I've said most of what I want to say. Okay.
Could you talk about preventing the spread via clothing? If someone is working in a hospital and might be exposed to droplets, what precautions should they take with the clothing that they wear in that environment when they get home?
Well, every hospital is having a different routine now. And I have to tell you, what is your real question? Is your real question, is it going to last on your clothing long enough so that you need to wash your clothes when you get home? Presumably people who are working in hospitals now who are exposed to sick individuals who have this virus are protecting themselves with clothing that is left in the hospital. They don't wear at home. Every hospital, my hospital right now is you can't go to the hospital unless you basically have this virus or you have some other very serious illness. So the nurses and the doctors are following very strict precautions. Now, every hospital is different, and I'm amazed, but the rate at which different hospitals across the country are adopting these measures has been enormously variable. Some are just coming online, some haven't come online yet, some have been online for 2 months.
So we know the virus can live on the clothing, is my understanding. So if a person is around patients, because it sounds like we've got a couple of folks on the call that are working in doctors' offices, they feel they're around people with the disease, and then they're coming home and they're in street clothes for that period of time where they're exposed to the disease.
So Denise, I would for the purposes of keeping us focused, I think you're asking very good questions that are general questions that need to be dealt with with the local people you're working with. Everybody's doing this differently. I think we need to sort of focus on what is particularly important for our ichthyosis patients. And every institution is dealing with these things in a different way. In terms of how long does this, there was just a new paper that came out about how long the virus persists on different surfaces. And it turns out that it doesn't persist on clothing very long. The way they do this is they inoculate, I can't remember whether it was 10,000 or 100,000 viral particles onto a surface, and then they come and they look for how much virus is still detectable there after X number of hours. And it turns out that on surfaces like clothing, the titer is reduced 3, 4, 5 logs within 3 hours. For other surfaces, such as stainless steel, it lasts much longer. But it's still this virus doesn't last forever. It's not like the spores for fungi. It's not like many bacteria that can live for very long periods of time on surfaces. This virus is inactivated over time by ultraviolet. It's inactivated just by drying out. And so after a reasonable number of hours, the virus is gone. And on clothing, it probably is not very persistent. Okay? So the final two things, the final two things I wanted to talk about, and I think this is important because in a lot of what we hear on the television right now, the social and the economic and the regulatory issues are confused with the medical issues. And I think one of the things that people have been very confused about is the issue of testing. There's been a lot of talk about testing. Testing is very important for the epidemiologists. It's very important for the medical community for us to understand how the virus is transmitted and who's getting it and how many people are likely to get it. But this is not important for very many individuals. Testing is only important if you think you are sick. If you think you are sick, you should get tested. But if you are tested and you're negative, that doesn't mean that you can't become sick and that you can't become positive at some future date. So I think the whole focus on testing has been a little bit confusing for people. So what the rules are, and the testing has not been generally available. There were only 200 tests in all of New England last week. All of the laboratories that were allowed to do tests could only do 200 tests last week. They're ramping things up now so they can do more, but they will only do tests if you have symptoms, if you have a fever, the symptoms being cough, diarrhea, fever, malaise, which is feeling tired. And if you've been exposed to somebody who is likely to have had the disease. I think they're going to change that very quickly, that last requirement, so that more people will get tested. But you only want to get tested if you're sick. And I'm sure there will be questions about that. Now, as far as treatment goes, there has been a lot of talk about treatment and treatments that are being developed. There are no treatments yet that are approved for use. So that's a quick discussion. I think at this point, I would like to turn it over to Amy, Dr. Paller, to talk more specifically about how this virus might affect people who have ichthyosis.
Just a quick question before Amy starts. There was a couple comments concerning, with the dry skin with ichthyosis. People are concerned about using soaps and even sanitizers. Is there anything that you could give assistance to for these people? Obviously, getting the virus off your skin is of utmost importance. But any tips you have, Len or
Well,
Amy?
yeah, I'm going to let Amy take that one.
It might be worth opening up at the end too, with regard to what people are doing to make hand washing and sanitizing a little bit more low impact for our skin.
Well, since Amy is either on mute or doesn't want to answer this, I'll answer it.
Amy's
So,
trying to speak, I can see.
Obviously, you know, we tell people to avoid using a lot of soap because it removes the lipids from the skin and makes the skin drier and scalier. But if you put emollients on immediately after washing your skin, that should reduce the problem significantly. It also turns out that the ethanol-based sanitizers, such as Purell, are not quite as drying as soap is. And so if you have access to those sanitizers, you might want to use those instead of soap. But I think what you need to do is wash your hands and have a tube of your favorite emollient to put on right after you wash your hands.
We're still trying to get Amy's microphone connection working here.
Amy thinks that maybe you muted her.
She's not muted.
She's on her phone. That's why.
Oh,
Oh, she called in instead of doing audio through Zoom.
text the number.
Yeah, I will.
Message me your phone number.
I'm on the audio as well as the computer Zoom, so I'm not sure if there's an issue with.
All right,
the
well, we'll
specific
unmute
microphone
everybody for a
connection there.
second then.
Yeah, so I sent her the phone number and the ID.
Thank you, Jeff.
Yeah, but she'll still come in as muted.
I mean, I see there are a lot of questions in the chat room about soap. And I would emphasize that it's far more important over the next several weeks to months to wash your hands, and even with
All right,
soap,
she just joined.
emollients,
So where is she?
rather than worry about how dry your hands are going to get. Remember, it's mostly your hands that will be transferring this virus to the susceptible parts of your body, like your face. Don't put your hands on your face. Don't pick your nose. Don't suck your thumb. Don't bite your nails.
While we wait for Amy, do you want to go over some of these other questions we've received earlier today, Len?
So
Okay, in the chat
I
room.
have, let's see, I can address some of the hand washing and hand sanitizing just a bit here from a first person perspective. So we know that the absolute best thing that we can do is soap and water. When that's not available, that is when sanitizers come into place. I want to be very clear with everybody because I didn't know this a couple weeks ago, but hand sanitizers will only work if you're making direct contact with the skin. And if you have a really thick lotion or cream on, like Aquaphor, you're not really going to necessarily get the benefits of the hand sanitizer that you might be thinking you are. So basically, unless your hands are completely free of anything greasy or physical dirt for that matter, the hand sanitizer might not be working fully for you. So if you're going to use a hand sanitizer, you have to put it on under your lotion. And for me, I'm really only ever in the position to put something on under my lotion if I have just washed my hands. So hand sanitizers for me are a very, very, very rare scenario in which my hands are free of cream enough that the hand sanitizer would work. And then you would want to put the cream on top of it. If you are in a case where you can just wash your hands, do that and then reapply moisturizer right away afterwards. Even so, that is a really, really painful thing at this point for me, washing my hands so frequently. One workaround that I myself have used, it was actually Dr. Gabby Richards' idea for me. She said, well, you could just wear surgical gloves. And so I wear surgical gloves, which allows me to keep lotion on my hands. And then if I'm out and about, I can just take the gloves off. Or if I have to use my hands and want to wash them while I'm out and about, I just wash the gloves and then keep going. So if I'm at Costco getting groceries, I'll wash the gloves on my hands and I won't take the gloves off at all until I get to the car, for example. We are pretty limited in our understanding of exactly what surfaces are going to respond how. But for me personally, I have decided that it's a much better thing for my overall health to keep gloves on my hands and to wash the gloves if I have to, and then take them off when I get home. So that does reduce a couple of times hand washing. And personally, I think it's easier. My skin gets really thick and my cracks get very deep. And so getting a full, really good hand washing in is not only painful, but it's much more difficult, I think. So that's an idea that works for me. If anybody has any others, we can definitely share tips and tricks and advice at the end or in the chat right now. But I figured I'd address it right now. Lynn, you're shaking your head. I think that there's more information that we want to cover with Dr. Paller. Amy, are you on the line yet?
No, watch. Let's go back. No.
So if Amy's not on yet, I'm going to go through a few of these questions in the chat room. Amy, when you come on, just push me off. I'm going to try to answer some of these questions, starting from one of the last ones that I see here, which is whether the ACE receptors are in the skin. The ACE receptors are not in the skin, so that's the reason that the virus cannot enter the skin. We don't know for certain. We do not know for certain whether in ichthyosis those receptors are expressed, but in normal skin they're.
Everyone, please make sure your phone or you're muted because there's too much feedback.
Except for Amy, I'm trying to help Amy.
Someone is asking they wear their scrubs home. I think that's a bad idea if they're actually working in a hospital. Tips for breaking the unconscious habit of touching your face, your eyes, and your nose. Well, you know, this is particularly difficult at this time of year in the northern part of the country, as all the trees are starting to come out and people with allergies are beginning to have itchy eyes and runny noses. This is, you know, it's easy for us to put this on the list of things to do in order to prevent this disease from happening, but it is much harder to actually do it than to say it. I'm sorry.
I have found too that if I'm wearing gloves, I'm less likely to touch my face. So that cuts down on it kind of subconsciously.
You gonna have bag? What?
There was a question about the risk of COVID-19 while on immunobiologics for the skin, like Dupixent.
Yes, that's the one that I was hoping that Dr. Paller would address, but if she...
Well, I can skip to the next one.
Skip to the next one. I mean, I can address that, but I would like her to do that one.
It says, how can the virus affect one of the two known individuals with lamellar ichthyosis and that also have lung involvement?
I don't understand that question. I'm not sure. It doesn't affect the skin. It only affects the lung.
And if somebody has lung involvement, maybe they mean there's the lung, they already have a weakness in their lungs. I'm not sure.
So people who have pulmonary disease, people who have diabetes, people who have hypertension, they're all thought to be at increased risk for, not for catching this virus necessarily, but for doing poorly when they have the virus.
There was another question, should we wipe down our soap dispensers and lotion containers?
Well, if yes, if you're using a liquid soap, I think the outside of the container can get contaminated, so that would be worthwhile. If you're using a bar of soap, I don't think you have to worry about washing the bar of soap.
Can you hear me?
Amy?
Can you hear me? What?
Yes, we can hear you,
Can
Amy.
hear me?
Yes.
Yes.
I'm sorry, everybody. I was on the phone and it wasn't muted. I think I was muted because we were all muted. Oh my gosh. And so I finally just disconnected everything and called back in and went through my computer. So I have no idea what's been discussed, what questions have been, but I'm happy to try to take other questions. Let's just leave it at that because I know we're short on time. You want to hit me with some more questions?
Yes, one of the questions, Amy, is this person has been on Stelara for ichthyosis since August of 2019. Does that put me in the significant disadvantage if I were to contract COVID-19?
Well, I think that we have to face the fact that when we're using some of these immunomodulatories, there can be some increased risk in contracting infections. Certainly not the kind of risk that we see with people who are on steroids or other immunosuppressive agents that are much more powerful. These are more focused, and they don't particularly have any known effects on viruses. Nevertheless, I do think that this is a potential issue, and that just means that you have to be that much more careful. The parallel is in the world of psoriasis. Psoriasis is another skin problem where there is inflammation and scaling. It can, what we hear from our rooms with this group of doctors is that if people have benefited from them, they are keeping them on the medication unless they're in a particularly high-risk group. So, for example, if you have lung disease or kidney disease, or you have immune dysfunction that is usually not a part of ichthyosis, or if you're quite elderly, that might be another reason to be particularly concerned. But for the most part, if you're doing well with this agent and it's helping you with ichthyosis, all of these things that we talked about, by washing your hands and trying not to touch your mucous membranes, that's all particularly important for you. Now, I don't know whether we talked about what social distancing means, and again, it means different things for different people, but we're using rules at my institution that you should be about 6 feet away. So when we're in conferences, we sometimes even have conferences together, we are sitting separated from each other. And we are also being cognizant of the fact that it's unusual to pick up something if it's less than about 30 minutes of time too. So it also depends on how long you're in contact. 24/7 dealing with COVID-19 and all the rules and regulations. And I'm also happy to talk about how we do things at our institution, which is, again, every place is different right now. But for Stelara and other immunomodulators, we just have to be a little bit more careful, but we're not discontinuing unless you have additional risk factors.
So does that also goes for Dupixent?
Now, Dupixent, we think it probably has even less of a risk than Stelara because it's very specific for what we call the Th2 pathway, which is like the allergic disease pathway. So we expect that to be even less of a risk. We're really not even thinking about that, but we're not using that for very many people with ichthyosis right now.
So in general, with all the different types of ichthyosis, people are asking specifically, with X-linked or with lamellar, they're saying, are they in the higher risk group in general or no?
No, I mean, Dr. Milstone just talked about how the virus doesn't tend to find its own receptors on the skin. The skin just becomes a vehicle for transferring to places like the eyes, like the nose, like the mouth, where we don't have really the same kind of a structure of the skin. So to our knowledge, none of these increase the risk in themselves. I think the bigger risk is just that many of the techniques that others may use who don't have ichthyosis may be really hard to take, like the excessive hand washing. I saw there was a question about, can I use a soapless cleanser? I don't know, maybe that was already answered. But our infectious disease specialists say that it's fine to use a soapless cleanser. It's really more the washing for the 20 seconds that's most effective. And I did like the idea of using the gloves, but do be careful, because we still have to be very careful not to touch the mucous membranes if you get the virus on your gloves.
Okay, I'm thinking that's pretty much it for the questions that were submitted prior to this conference call. There's a few more that are popping up here. Someone mentioned prednisone, neotigasin. I'm not sure what that one is. Okay.
So we were talking about some of that before. So prednisone, when taken internally, is clearly a suppressor of the immune system. And anyone who is taking prednisone on a regular basis, I'm not sure why that would be at increased risk for sure. Now, using topical steroids, even though there are barrier issues, to use them intermittently, even for example, because your hands, when you're trying to wash them, are really getting dry and sore, you're getting almost like an eczema type of setup on your hands. We are using topical steroids. We're not really worried about that, but systemic steroids taken by mouth are definitely immunosuppressing. Now, neotigasin, and in the United States, we have like acitretin and isotretinoin. These are our retinoids. And to our knowledge, they do not suppress the immune system. They certainly can dry out your mucous membranes, but we don't have any information right now that being on a retinoid increases your risk. It is not immunosuppressive. And my experience with those who have ichthyosis who are on retinoids is that they don't have any evidence that that would be a problem.
Great, thank you, Dr. Fowler. There's a couple more questions here in the chat. I'm just gonna kind of ping pong back and forth with you, Chris. Ethan Edwards is asking if treatment or risk factors or risk level would be different if an affected individual contracts COVID-19.
Well, I think, for example, if you contract COVID-19 and you are on anything that's the least bit immunosuppressive, obviously that would be stopped immediately. There wouldn't be any question, then you'd be in particular danger. Something that's immunosuppressive, yes. Obviously, if you're ill and you get tested, and particularly with the fever, the cough, any respiratory symptoms right now are the big ones that we're looking for, then you would talk to your doctor, you would get linked up to a hotline, you would get the testing that you need, hopefully. And this is often being done in the emergency rooms at hospital. And if you were sick enough, you'd be admitted if you are found to be positive, but you're not that sick, you'll probably you might go home and just be in quarantine for the next 14 days or whatever works for you. Many of these individuals are coming in the hospitals, but only if they're really sick. It depends on the degree of severity in terms of how they're going to treat right now, but for the most part, it's supportive care later. And obviously that requires hospitalization. But I can't really think of anything that would be different if you had ichthyosis, other than the fact that obviously, being in a hospital and having intensive interventions is not great for your skin. We all know that.
Hello.
Okay, Amy, there's also a question regarding not being able to regulate their temperature, with fevers in general. So with this COVID-19, is that a bigger risk for our members?
Well, as with any virus infection, you can get a fever. Our cutoff in terms of fever is 100.4 degrees at our institution. And we're following the CDC recommendations. So many of the people are not having very high fevers, are having the kind of fevers you often see with viruses. So I think it depends on the degree. If you get sick and your temperature is 104, 105 degrees, that's really dangerous for anyone. There's nothing special about this. And obviously, if you do have a high fever, for whatever reason, and by the way, most of the people that were tested right now are having other viruses that cause upper respiratory infection, form of flu, not COVID-19. About 9 or 10% of people that we're testing are proving positive. The rest of them have other viruses. But if for any reason you have a particularly high fever, you should be doing all the care that you would if you don't sweat well and you have a fever, which is lots and lots of kind of water and substitutes for sweat on your skin. In addition to trying to bring it down, of course.
Hello.
I can hear you.
Are there any, I'm sorry? Was someone trying to ask a question?
No, that was just Laura.
Okay, you can put it back on mute just so we don't hear the feedback. I'm just scrolling through these questions. I don't see another question. Denise, do you see anything?
We had a question in general, just on our website on the disease specifics. We say we're just trying to help understand people with ichthyosis and whether or not they might also be high risk. So having ichthyosis itself doesn't make one high risk for disease severity. But if you have temperature regulation issues, respiratory issues, or immune compromising issues, those situations, we said to go ahead and follow the CDC's higher risk precautions. Amy, is that something that you can elaborate on?
Yeah, so obviously this tends to affect people who tend to have chronic illness, and we're not talking ichthyosis, but chronic illness like diabetes, renal disease, or kidney disease, that is, and certain respiratory illnesses, just because they tend to somewhat weaken your immune system, but they just may have a tendency toward greater illness with COVID infection in general. And much of what we've seen in terms of the illness that it's causing is from older individuals, started about 60, just going up from there as you get older, much higher risk of having more severe disease.
We're not hearing you well,
It's actually
Amy.
very interesting, anybody to identify children still as being COVID positive. If anything, just concerned with their.
We're having trouble hearing you, Amy.
Yeah, you're fading out. Not sure if your connection is that great.
You're not hearing me?
You're breaking up a bit.
Yeah, your connection seemed.
Can you hear me now?
Yes.
I moved.
Oh, excellent. Perfect.
Okay.
Much better.
So there are certain risk factors that make your disease have greater severity. For some interesting reason, it seems to spare children to a large extent as long as they're healthy. But we don't know, for example, if these asymptomatic children are then going to be spreading it. So that's a concern that we have right now as well. But to our knowledge, having ichthyosis is not a problem. You raise the question of whether there would be an issue with fever. And again, yes, there's an issue with having fevers if you don't sweat well and having to manage that just like you would anything else. But otherwise, unless you have one of the unusual forms of ichthyosis where there is an immunodeficiency and recurrent infections, including the potential for viral infections, then it shouldn't be an increased risk.
Amy, would you be able to name specific types that might be affected by that? Some people are asking.
Yeah, well, there are some types where you can have, for example, some people with Netherton syndrome have problems with immunodeficiency. And there are other forms of, rare forms of ichthyosis, like there's a type with neutropenia. So there are some rare forms, but for the most part, that's not an issue. So I want to be reassuring. Who have immunodeficiency know it because they have recurrent infections beyond the skin.
Okay, that's good.
And was there any mention before of Darier's? Was there a certain concern for them?
Well, dairy eye disease, I think, is one we have to think about. Individuals with dairy eye disease in particular have a predisposition to herpes infections, but not necessarily to, for example, getting things like colds. Coronavirus, remember, in its milder form is a cause of the common cold. So it seems to be more specific to certain viruses. Just like patients who have more severe eczema have more of a risk of herpes infections, but not necessarily having we don't think they're at increased risk, for example, with the COVID virus from what we know so far.
Is there any concern, extra concern for those of our members who have Harlequin ichthyosis?
No, I don't think that there would be. We don't. We certainly know that it's a very severe form of ichthyosis, but mucosal issues are not a major concern.
Okay. Is there any other way anyone could help themselves in terms of boosting their immune systems?
Well, not that we know of right now. You know, Dr. Milstone's talked a little bit about therapy, but it's all very experimental right now. Some anecdotal reports of some drugs that we use not for ichthyosis, but for some others that are old anti-malarials, to some newer agents that are antiviral, to really doing something with the receptor that it binds to on the mucosa. These are all being looked at. I think the exciting news in the last 24 hours was the injection of the first healthy individual with the lowest dose of the vaccine, beginning the testing of that. And if that ramps up and proves to cause immunity, in a year to a year and a half from Dr. Fauci's estimate, we might have something that could be rolled out to the public. So lots of things in the works, lots of people doing a lot of studies, but nothing simple.
Can I just jump in, please?
Yes.
ahead, Mui.
Hi. So I just, the only reason I wanted to jump in on this is because obviously I was talking to my doctor in Hong Kong because that's where I live. And she actually recommended, in terms of like keeping our bodies healthy, like during the whole COVID-19 situation, is a lot of stuff like vitamins, things like vitamin C, things like zinc, stuff like that. Is that like, would you agree with that? Or like, at
Well,
least
there's no scientific testing that any of that makes a difference, so I can't tell you. In general, those have not really been useful on the whole for colds, for example, or other upper respiratory infections. So I don't know what to tell you, but obviously no one has tested that. Getting extra zinc, getting extra vitamin C isn't going to hurt you, but eating a good diet, keeping up with your exercise, getting enough sleep, just taking care of you and yourself in general, in addition to this social isolation and all the other tips that we've talked about, is always part of a good plan.
Okay, cool. I mean, it's just obvious. I mean, obviously, I'm not like dispelling anything. Obviously, I mean, but I just wanted to give a few things, because obviously Hong Kong I've been since January, so I've had a bit.
None of those will hurt you. Let's put it that way.
Okay, cool. All right, I'm turning on mute again. Thank you.
Thank you for contributing. We also know that staying connected despite the social isolation is important. And one person was asking, and I know we've heard it in other places in our communities, is what can we do to stay connected going forward? And so first is going to look at what we can do to maybe keep a format similar to this, or maybe a little bit more casual going forward in the future. So we definitely hear the need there, not only to discuss this medical information, but just to kind of combat the anxiety and the stress, as we already know that folks with ichthyosis tend to be inordinately also affected with anxiety and depression. So staying connected through this time as a community is very, very important. And first, we'll do whatever we can to facilitate that. On that note, I'm excited to share a grassroots effort that came up today. We had some wonderful folks in our parents group volunteering to send each other products that they weren't able to find in their own communities. So it inspired us to help connect these types of needs with these types of people that could meet that need. So we're calling it First Angels. And if over the course of your social distancing, your quarantine, you don't have the money to buy a product that you need because of the economic impact, if you can't find it because it's not, it's out of stock, or if you're not comfortable leaving your house, we understand that it could be very difficult to get the cream and especially in the quantities that we need. So if you go to our Facebook page, we've got a Google Doc where you can type in what you need, and somebody can volunteer to be your angel, kind of like an angel tree. So we're excited to help connect and mobilize resources in that way. If we've got demand for us to continue having weekly meetups or routine get-togethers in a digital way, I think that's definitely something that we'd love to do. First, historically have provided similar kind of phone calls that are more medically based. So we're looking at evolving this concept of first to know as we kind of get through this uncertain, crazy time. So I think that responds to a couple of things that people had mentioned in the chat. Chris and Lisa, do you guys see anything else that we want to address?
I'm looking. I think we're in good shape.
Yeah, I think we hit all the major ones, and really everything. If somebody has anything real quick to throw in the group chat.
Somebody did ask about whether there have been any cases in individuals with ichthyosis, and I will say that those kinds of things are not reported, but I'm sure if anybody would know, it would be first.
Right.
Amy, got a question. I was in Florida. Now I just came back. Is there a way, should I get tested?
Nope, just because you were on an airplane doesn't mean that you've been exposed.
No, I wasn't in an airplane.
Oh, you drove?
Yes.
Oh, even better.
Yeah.
No, you definitely shouldn't be tested unless you get symptoms. So again,
Okay.
cough, fever of more than 100.4. Certainly if you get respiratory, flu-like symptoms, aches and things like that have also been on those. And then less commonly, a variety of other manifestations. Those are ones that should prompt you. There are out there COVID hotlines you can call, and you also can just talk to your doctor about it. What you would do is you would go to an emergency room. They would determine, you don't want to overwhelm them. So really talk to your doctor first if you can reach somebody fairly quickly. But emergency rooms are making decisions about who to test, who not to test. But we are not testing people who don't have symptoms right now. And again, the vast majority of those with these kinds of symptoms are proving to have other infections, not COVID-19.
Okay. Thank you.
I have a question.
Yes,
This
go
is
ahead.
Stephen Fleury. This is Stephen Fleury, and I recently went through head and neck cancer treatment. And since I have completed treatment, I have been dealing with two different things. I experience bruises on my body that I don't have any explanation for. Some of them are small and some of them are large, and it's not from bumping into things or doing anything like that. I've had my blood tested, and my blood tests are coming back that my hemoglobin's a little low, but not dangerously low. Sure, and some of my other blood panels are coming back low. Tomorrow I'm going to Moffitt in Tampa, and I'm a little concerned. I plan on gloving up and masking up while I'm there, but my doctors are at a loss as to why this is happening. And they're saying it could be ichthyosis related, but I've never experienced any bruising prior to cancer treatment. Has anybody experienced any of these issues in the past, or have you seen anything like this before?
Well, first of all, let me mention that with cancer, you do have increased risks. You just got radiation and nothing else? And surgery?
No,
or?
I had chemo of cisplatin for 7 weeks, and I had radiation on my head and my neck for how many treatments did I have? 37 treatments of radiation.
But I assume that the bruising is more extensive. Well, first of all,
yes,
I didn't mention cancer before, but if you have cancer, and certainly with that kind of a history, you definitely are also at increased risk. You need to be extremely careful. And I certainly agree with you that you're going to have to protect yourself. I think you need to work with your doctors to figure out if there's a reason for that, but I don't think it relates to the ichthyosis.
I didn't think so as well, but I thought I would ask because we're sort of stumbling as to why, other than I think it has to be due to the chemotherapy treatment that I went through.
It's possible.
But I thought I'd ask. Okay.
There is one comment in the group chat that somebody had bruising on their legs after treatment for skin cancer, squamous cell. Just mentioning that.
Interesting. Some bruises I have currently, and I've finished my treatment in July of last year, and I'm this far removed. And yesterday, because I live in Florida, I'm wearing long pants and long sleeve shirts to reduce my radiation intake, and hats, wide brim hats, etc. But the bruises are like literally the size of my hand over the course of my body. At first they were small, but now they're getting larger. I just thought, I didn't know if anybody experienced this, but I'll bring it up tomorrow. And I had one last question. Should I take a change of clothes for after I'm done going through that place? Should I change clothes before getting back into my car? I just would hate to have somebody in the facility. You know, it's a hotbed, it's a medical facility, and I'm thinking, do I take an extra change of clothes and change?
It sounds like it would make you feel better. So
okay, fair
take
enough.
some gloves with you, and you know, do what you need to do. Hopefully, you wouldn't get any kind of an exposure for any prolonged period of time. And it sounds like you're going to be wearing some protective gear. So probably not
Okay.
going to be an issue, but take them with you. It's easy enough.
Thank you. Appreciate your time.
All right, everybody. We are out of time. It's been wonderful to get to see so many people. I want to especially thank all of you who shared your video. It's been really lovely to see people that we usually only get to see during our in-person meetings. So thank you so much for your time with us tonight. I know that this issue continues to weigh on the whole world. We'll continue to monitor it. We do have a couple of resources up on our website. As new information becomes available, we'll try to keep it updated there, also on all of our social media platforms. So please stay in touch. You can always call the office or email the office. We are working remotely now, so you might be better off just emailing us directly. You can email info@firstskinfoundation.org, and we'll get back to you there. Thank you especially to Dr. Paller and Dr. Milstone for your time and guidance tonight. It really means a whole lot to have information straight from the source that can help us interpret what this means for ichthyosis. So on behalf of all of the families, myself included, I'm very, very relieved that I can't get coronavirus through the cracks in my hands, because I think I probably would have picked it up by now if that were the case. So phew, that's a relief. But thank you to everybody that joined us, and please stay in touch. If you've got feedback as well, you can send it to us at that info email address. And thank you to Chris and Lisa for helping orchestrate this all remotely. We are learning a whole lot as a remote foundation right now. So thank you, everybody. Take care, wash your hands, and put lotion on.
Thank you,
Have
everybody.
a good night, everybody.
Bye-bye.
Bye.